Aphasia is an acquired communication disorder. This means that no one is born with aphasia. It can happen as a result of illnesses such as stroke, brain injury, or primary progressive aphasia. Aphasia affects someone's ability to use and understand language when speaking, listening, reading, and writing. Aphasia does not affect intelligence. Someone with aphasia may appear to struggle when speaking, have difficulty forming words, say and write unrecognizable sentences, or misunderstand what they read and hear. They may not always be aware that they are having difficulties. So how do we communicate with someone with aphasia? Firstly, it's important to be patient and allow them time to try and get their message across. If needed, we can ask questions to clarify or confirm what they mean. Oh, a cup.
Cup. So that I can.
Oh, you want to drink water?
Yes, I want a cup to drink water.
Oh, I see. Okay, to drink water. I see. All right. We can also use pictures, keywords, gestures, and facial expressions to support our message. Writing or drawing on an iPad or on a piece of paper can also help someone with aphasia to get their message across. There is plenty we can do to support someone with aphasia. If someone you know has aphasia, speak to a doctor to get referred to a speech therapist.